For those jonesing to hear something done by a Jones, it's the Medicare for the Lazy Man podcast. The Medicare podcast with a heart of gold. Here is the man who spends his spare time counting to infinity. It's Medicare expert Doug Jones.
Hello, everybody. If you sense that I'm out of breath, it's because I've been wrestling with my timer, and I think I was on the losing end of that wrestling match, but I want to say this is Doug Jones, your Medicare expert, and you have arrived at the Medicare for the Lazy Man podcast. I've been accused by several of my friends of recording the opening to the podcast episodes, but in your case, you're listening to a real live 2 out of 3 throws victor in the timer wrestling match Olympics here at Medicare for the Lazy Man podcast. Now, why do we have a podcast? Well, we have a podcast so that I can show people who are approaching Medicare enrollment that it doesn't have to be a scary, complicated, frightening thing. It can be the entree to a wonderful new health insurance life. And how do I do this? Well, I show them my book, Medicare for the Lazy Man. The current edition is 2025. And for those who are interested in learning about Medicare, I send them to barnesandnoble.com or amazon.com, where they can pick up a copy of the paperback version of the Medicare for the Lazy Man, or they can pick up a Kindle version, or they can pick up an Audible version, or if they're really, really strong, they can pick up a hardcover version. That's a little on the hefty side, but it is a durable and beautiful creation. And what will one find inside Medicare for the Lazy Man 2025? One will find a blueprint to the operation, to the enjoyment, to the enrollment processes one needs to enroll in Medicare and to decide about the supporting coverages that one might need to make Medicare work to its utmost capacity. And one might find also how to acquire a licensed insurance agent such as myself to make those other things happen. And before you know it, one has traipsed through the process and come out the other side smelling like a rose. Now, I also have published a book called Medicare Drug Plans, a simple DIY guide for those of you who want to know how to select your own best drug plan rather than relying on the advice of some stranger with questionable motives that you may not even know about, who may guide you only in the direction of one of the few plans that actually still pays commissions to the agent. Then you're going to find this to be a valuable tool. Medicare Drug Plans, a simple DIY guide, shows you how to select your own best drug plan, and by best I'm saying the cheapest plan that accommodates your needs. And then it shows you how to enroll in that plan, and it's all so simple a child could do it. In fact, I've seen children who can do this sort of thing better than most adults, and so I recommend purchasing my book Medicare Drug Plans at the same time that you purchase Medicare for the Lazy Man. And I will say also that there is a third book coming very, very soon. I am calling it Medicare for the Lazy Man Bare Bones. It is a short, sweet, inexpensive guide to how to enroll in Medicare, how to select your best Medicare supplement plan, and how to enroll in that, or at least how to let your insurance agent enroll in that. That book is coming out very soon. I just finished it at midnight, and I'm so excited that I think it's going to fill a gap in the need, the group of people that are approaching Medicare. There are 2 elements of that group that I have not served well. And as I say at the beginning of the book, those 2 elements, those 2 cohorts, those 2 types of people are the cheap and the impatient. And so that's exactly what Medicare for the lazy man, bare bones, was designed to serve. It's going to be really cheap for those people who don't like to spend money, and it's going to be a quick read for those who are impatient. It's not like a textbook. So those are the three books that you're going to find when you go to Amazon.com. And what I find when I come to the desk and I look into my computer screen is a guy who just returned from a magnificent tour of England, Wales, Ireland, parts of Normandy. And where else did you go, Randy?
Scotland.
Scotland. There you go. How could I
Yeah.
forget that? And
How could you forget Scotland?
and except for the flu that you all had, which laid you low for quite some time, how was the trip?
Yeah, it was really nice. It was good. Ultimately, I think my favorite part was the few days that we spent in London after we got back, because I got to go see Highclere Castle.
Right, you were going to tell us all about your tour guide there.
Yes, yes. Tour guide, his name, Tony. Tony. He was a great guy, and his name was Tony Lawless. I'll give you the whole name.
Okay,
He's a great guy. He had all kinds of personal knowledge, all kinds of personal stories about, because he'd been in the business, not just the tour business, but he had been in the show business and things around the show business for, 30 years. And so he knew a lot of the actors on Downton Abbey personally. And it was just an awesome experience because oftentimes you go on these tours and they're just doing a canned, they gave the guy a script. Oh, well, here we are rolling up to Highclere Castle, and all they know is what's on the script. Well,
right,
Tony had personal knowledge of it all, so it was great. I loved it.
cool.
I loved every minute of it. So we have ultimately spent time in Highclere Castle, and it's if you haven't been there, I know you have to be a Downton Abbey freak to really do this, but
Yeah,
it was definitely worth the trip. It was a little pricey, but I felt it was worth it. And I think I may have told you in the last podcast that we were waiting in line for our turn to go in. So they kind of dribbled us in, three or
right,
four at a time, so we
sure.
didn't all run in there like a herd of cattle. And the lady and her husband right behind Margaret and I were our tour guide Tony always called one person the fan and the other person the hanger-oner. Okay, well, I
Now, is
was
that
the
true? Is
fan
that true in all couples?
pretty
Because
much. Well, I can't say in all couples, but
but you're the fan in your family, and
yep,
the other party is not.
yep.
And in my house, I am not the fan, but the other party is.
So you're the hanger-oner.
I guess. Yeah, I guess I would be the hanger-oner.
Yeah, Mary's the fan and Doug is the hanger-oner. In my case, Randy's the fan and Margaret's the hanger-oner. And in this couple we were standing right in front of in line, she was the fan and he was the hanger-oner. I thought this woman was going to pass out before we got in there. She was
Uh,
so excited to
uh-huh.
do this, and it was her birthday. I mean, you would have thought that they had told her, you're going to get presented. I mean, Lady Mary is going to be there to shake your hand in person.
Wow.
She was so excited. And I was so happy for her because she enjoyed every minute of it. And that's great because ultimately it puts you into a situation mentally where you can step back into kind of an older time. It's an entirely different way of thinking about things, and I really think, and Tony agrees with me that that was the reason I got so hooked on it, is that it was a very structured, very well-known time, very polite time. Everybody knew their job, everybody knew their place, and it
Sure.
just is about as far away from today's world as you could get.
Well, let me ask you this about the manufacturer of the actual show itself. You've been to Boston a lot. I'm sure you've gone to Cheers, the bar
Yeah,
where Cheers,
yeah,
which I forget the real name of that bar, but the outside looks just exactly like it does during the TV show. And
yeah,
then inside, there's no resemblance whatsoever. When you walk into the real deal, it is
yep,
totally, the floor plan is totally different. And
yep.
so I'm wondering if they tried to make the show sets that they actually filmed the action on look like the actual interior of the Highclere Castle, or did they just do the floor plans that they thought would serve them the best and there was no relationship?
The set matched Highclere Castle.
So
No,
you looked like you were there on the set
yeah,
when you were in the castle.
yep.
Cool.
And it was really a cool thing because obviously I've watched every episode that exists probably 3 or 4 times. I'm being a little facetious, but at least twice. And you could walk into the castle and you could spot things that you saw during the show, even though it was filmed in London on a
Uh-huh.
set. But you could look, say, oh my God, that's where this happened, and that's where this happened, and it was exact. They duplicated the interior of Highclere on the set in London.
Wow.
So it was really really an experience when you were going through Highclere because you could say, oh my God, that was this show and that was this
Uh-huh.
show, and bottom line is I enjoyed the heck out of it, and really the part that I enjoyed the most was seeing the exterior. Well, I've seen the exterior of Highclere, but the grounds around it. Okay, it's considered to be, a relatively small to maybe large small or small medium size, estate.
Yep.
And because over the years, Highclere has been whittled down for, this reason and that reason, and things have been sold off,
Mostly, I bet, paying taxes.
Yeah, exactly. That's exactly what it is. But Highclere is still over 6,000 acres. So,
Well, I hope they don't have to do a whole lot more whittling though, because it's going to
yeah.
lose its
Oh yeah.
glow.
Yeah.
I would. Wow.
But if you can imagine, I mean, your background is English, so you can imagine what's sitting in the backyard, so to speak, of
Yes.
Highclere Castle and looking out over your domain of 6,000 acres. I
Right.
mean, it's just an experience that you cannot duplicate.
That's got to be a beautiful thing, and I'm sure they maintain it well, considering the amount of money they extracted from you and Margaret
Yeah, it
in
was
order
it
to
was
tour.
it wasn't like $3 to go. It was a little pricey, but it
Yeah.
was well worth it. It
Well,
was well.
good. That's a perfect situation when you maybe pay more than you want to, but you don't feel like you've been ripped off and kicked in the teeth when you leave.
Well, and the add-on or the extra that you get with Highclere Castle is that's the one of the I think it was as we were talking earlier, I think the one of the original, if not the first, Lord Carnarvon
Yes.
was a Egyptologist,
Yes.
and he built a wing in his castle that was basically devoted to everything Egypt.
Yeah, and I thought there was an agreement that England was going to have to return all the artifacts that they had taken from the other
No.
countries. Yes, well, that's what I found out. I went to my Perplexity AI and I asked all about that, and it turns out that they do not legally have to return, especially to Egypt, because the government of Egypt at the time that Lord Carnarvon was helping himself to the antiquities, the government of Egypt signed off on it. And they said, "Here
Yeah.
you go, help
Here you
yourself."
go. Yeah,
So,
take some more mummies. They used to have. I mean, this is probably way too much information, but back in the day in England, when the Egypt craze was going on, they used to have mummies shipped in, and the aristocracy would have a party, and
uh,
the sole focus of the party was to drink and drink and drink and drink and drink and drink, and then unwrap the mummy to see what you had, like a Christmas present.
oh boy, and what would they find upon
We don't
unwrapping the mummy?
we don't know.
And we may not want to know either.
We may not want to know what you found,
Oh
but
boy,
and then here's one that's probably way too much information, but over the course of time that there was some crazy people in the world decided that mummy dust was good for you, so they would grind up mummy wrappings and
oh
people would
boy.
snort mummy wrappings, and I don't know what it was supposed to do for you, but yeah, there was a lot of weird stuff going on back
They
then.
might have want to cut down on the drinking a little bit. Oh boy, those are
Gin, we're
my
gonna have
peeps.
we're gonna have gin and tonic and mummy dust tonight.
Yeah, those are my peeps that thought that stuff up. So, oh boy. Well, I've never been so proud to be an Oklahoman. Okay, let's get down to business here. We've got some
All right,
Medicare to do.
let's make some money here. I'm going to
Okay,
go ahead
well,
and mute myself out, and you can kick it in.
well, we always start off with a Medicare Advantage, and this today, the Medicare Advantage Minute, is taken up by a story that confirms what Randy and I have discovered in the past, that many of the Medicare Advantage denials are overturned by the people that are actually going to go to the effort to file the appeal. So in this particular case, they've got some statistics. 17% of Medicare Advantage claims are denied. That seems high to me because there's no figure anywhere near that for actual Medicare. If you don't have a Medicare Advantage plan, then you have actual Medicare, and Medicare doesn't deny anywhere near that many claims. But if you have Medicare Advantage, they have taken away your Medicare and they have substituted their own insurance plan, which is either an HMO or a PPO. It's called managed care. And according to the headline in this article, 17% of Medicare Advantage claims are denied. Now, of those denials, 57% are overturned when somebody decides to appeal the denial. 17% of initial Medicare Advantage claims are denied, but 57% of originally denied claims are ultimately overturned, according to a study published in June last month in Health Affairs. The study analyzed 270 million claims from 2019 based on data from Inovalon, which covered about 30% of the total Medicare Advantage market. The data spanned multiple Medicare Advantage plans, included inpatient, outpatient, professional, and post-acute care claims. On a dollar-weighted basis, the denied claims resulted in a 7.2% net loss of the total billed amount for providers. Denial rates varied by the type of care, with outpatient claims seeing the highest initial denial rates of 21.1%, followed by inpatient and physician claims at 17.3 and 14.6%, respectively. For outpatient claims, there was an 8% net claims loss after considering overturned denials. The study also found disparities in denial rates based on membership demographics. Black beneficiaries had an initial denial rate of 22.7%. Hispanic members had a denial rate of 20%, and Asian beneficiaries, Asian members of these Medicare Advantage plans, had a 16.4% denial rate, while whites had a 15.3% rate. So what does that tell you? These plans have gone after Black and Mexican or Black and Hispanic Medicare members of their plans with much more vigor than they've gone after the claims of Asian and white members. PPO plans saw slightly lower rates of initial denials and higher net revenue losses for providers compared to HMO plans. All righty. Well, that's just another example of the evil that is Medicare Advantage. And it is kind of a frightening aspect to me that we have not gotten a handle on these plans. But the good news is we are now at the point of time in the subject or in the episode where we have the Your Medicare Benefits segment. In this case, we're taking our data, our content from Your Medicare Benefits 2025, which is a government book that actually lists all of the things that Medicare has figured out that they could do to you and that they could pay for in many cases. Some of the things they don't cover, like, tooth extractions and things like that. But in this case, they're covering a subject called monoclonal antibodies for the treatment of early Alzheimer's disease. And the definition of early Alzheimer's, I looked that up to make sure that we all knew what we were talking about. Early Alzheimer's disease is defined as symptoms manifesting before age 65. So how would Medicare handle monoclonal antibodies for the treatment of early Alzheimer's disease? Well, Part B of Medicare may cover FDA-approved monoclonal antibodies like Leqembi, that's Leqembi. The generic name is lecanemab, that target beta amyloid plaques for the treatment of Alzheimer's disease. If you meet certain criteria, your doctor or other healthcare provider must confirm that you have beta amyloid plaques consistent with Alzheimer's disease, and they must diagnose you with one of the following: either mild cognitive impairment due to Alzheimer's or mild dementia due to Alzheimer's. So apparently, in this case, cognitive dementia or cognitive impairment and dementia are defined as two separate things. Medicare coverage of those monoclonal antibodies also requires your health care provider to collect evidence about how well these drugs work for a qualifying study or registry. The information your provider collects will help answer treatment questions and describe how well the medication works for you. Talk to your provider to find out if monoclonal antibodies for the treatment of early Alzheimer's disease are right for you. Now, what about the costs? Well, for Part B, as in Bravo, covered monoclonal antibodies, you pay 20% of the Medicare approved amount after you meet the Part B deductible. And not if you have a Medicare supplement plan from Doug Jones, you won't. That's going to be an entirely different situation. All of these articles assume that you do not have any supplemental coverage. Also, you may need scans and tests before or during treatment that might add to your costs. So talk to your provider for more information. Things to know: these medications may slow or delay symptoms of Alzheimer's disease, but they don't cure or reverse the disease. Also, if you don't meet the Part B coverage criteria for an FDA-approved monoclonal antibody for the treatment of early Alzheimer's disease, you might be able to get the medication covered through a Part D drug plan. Contact your plan for more information. So if you, let's see, you want to visit medicare.gov/coverage/monoclonal antibodies -for -the treatment of early Alzheimer's disease. But then you'll find out exactly whether Medicare is going to help you out with that. It sounds like they want to encourage the use of these monoclonal antibodies. And I have now an article. Humana has been in a turmoil ever since the trouble started with the Medicare Advantage plans, but somehow they found the wherewithal to reach out and make an expenditure. So Humana agrees to purchase a bankrupt Florida provider called the Villages Health, and they're paying $50 million for this. The insurer's bid is preliminary and kicks off an auction for the debt-laden provider, which decided to undergo bankruptcy after discovering that it owed Medicare hundreds of millions of dollars. It just discovered that one day. Pretty interesting. So the items in the article, or the elements of this particular situation, are: one, Humana has agreed to acquire the debt-laden Central Florida healthcare provider for $50 million as the insurer continues to build out its medical network nationwide. Number two, Humana's health services subsidiary, CenterWell, has agreed to acquire the Villages Health as part of the provider's strategic restructuring, which includes a Chapter 11 bankruptcy filing, according to a release. The Villages Health said it decided to pursue bankruptcy after discovering significant Medicare billing errors. Oh, really? Which put it on the hook for hundreds of millions of dollars that they received in overpayments and penalties. And let's see, further, the provider's sale to CenterWell is still subject to court approval. CenterWell could also be outbid by other parties in the bankruptcy auction process for the Villages Health Center. Or the Villages Health, it is. And they have 10 medical centers. And the content curator discovered some more interesting stuff on the back of this thing. In the release, CenterWell president said that the division is looking forward to bringing its personalized, integrated approach care to the Village's Health. A Humana spokesman declined to provide more details on why the company was interested in acquiring the Village's Health. However, Humana has been steadily building up CenterWell to provide primary care to enrollees in its insurance programs, hoping to save money and improve outcomes by better coordinating care. By owning the providers, Humana can also pay itself for providing health care, keeping a greater share of the members' healthcare spending in-house. CenterWell's profits are growing steadily as its network grows. The division posted operational income of $392 million in the first quarter, up 39% over a year ago. So pretty exciting. And then once again, because the content curator demands it, I must revert to correspondence with one of my clients. It's always a pleasure to hear from them, and I encourage them all to contact me whenever there's a question or a problem. And what do I have here? This is our buddy Steve in Texas. He said, I put in a plug for you. And then he gave me a link. Oh, I should probably check this link out before I actually report on what he said. So I'm going to put that aside and go to another piece of correspondence. And this is from, oh boy, this is a long one. This person has lots and lots and lots of questions. He says, hi, Mr. Jones. I read your Lazy Man book and I had a couple of questions for you. I just turned 65 this week and I've read several books and documents on Medicare. I also attended my local city HICAP, HICAP seminar in California. I also followed up with one-to-one counseling session with a volunteer. I plan to sign up for Part B of Medicare in the next several weeks, as well as get a Medigap supplement. I'm leaning toward High Deductible Plan G, but I would be okay with Plan G or Plan N. I already signed up for Part A as it was a no-brainer. I'm retired, but my insurance is covered by my spouse's employer. My premium for it is higher than the monthly charges plus Plan G, regular Plan G that is, almost $500 a month with United Health. I won't be in the lowest Medicare bracket this year, but I can appeal due to a drop in income. The seminar advised against Part G high deductible, and I was puzzled by their feedback. I am reasonably healthy, but I do anticipate the usual heart, hypertension, adiposity issues in the next 5 years. That's not a word I use very often. I have not missed a physical in the last several decades. I know how to read my own blood work, and I also have attended South Asian heart seminars for advanced credit. I'm not a physician, but I play one on TV. I am current with most medical articles. I'm a strict vegetarian, and I eat a lot of vegetables. Unfortunately, I also eat and drink junk. I expect my first hospitalization by age 70 or so, even though I'm currently in good health, not on any meds. I have practiced daily intermittent fasting for over 9 years. Expect to continue the fasting for the foreseeable future. Man, this guy has a lot more self-discipline than I would ever practice, I'm thinking. I saw some numbers on another website saying that I can save $26,000 if I sign up for High Deductible Plan G. $26,000 savings. Well, that seems right to me if you're talking about your whole lifetime. Do you have any actuarial data to support the risk I'll be taking on with High Deductible Plan G? Also, I listened to your podcast where you recommended United American. I need Medicare just as a safety net. I can handle very large expenses on my own. That's also why I did not sign up for any long-term care. I figure I can invest the dollars and get excellent returns in the marketplace. Please share your thoughts. I'm a very private person, so please do not share any of my info in any book or podcast. Well, I haven't told anybody what his name is or where he's located. I don't even know if it's a he or a she, to tell you the truth. P.S. My understanding is that High Deductible Plan G will entail extra paperwork and bill payments. I am okay with any amount of detailed paperwork, but I don't want to put my family through it all, if at all possible. If I am down in bed, they would have to pick up the paperwork. And I responded to this. Hello, Thanks for giving me an opportunity to explain my position. It sounds like you're doing everything possible to live forever, and I applaud that effort. I only have one small contribution to make to your future well being, and that can be expressed in terms of dollars and cents. I consider it my responsibility to assist you in reaching the least troublesome financial arrangement when it comes to your health insurance. If one buys a high deductible Plan G, there will be a monthly premium savings when compared to the regular Plan G or Plan N that one might have purchased. When asked for Medicare supplement quotes, I illustrate the premium savings that may be used to offset the cost sharing expense that is part of high deductible Plan G. I illustrate the best case scenario in which a person has no medical expenses in a given year, as well as the worst case scenario in which one has some medical expenses that require the maximum payment of cost sharing. The best case shows an annual premium savings with high deductible Plan G, and the worst case scenario is never really that bad. So I think high deductible Plan G works for just about everybody. When the inevitable rate increases are levied on Plan G or N, those rate increases are likely to be larger and more frequent than they will be with high deductible Plan G. If one lives long enough, the annual premium savings will exceed the amount of cost sharing exposure, thereby making high deductible Plan G the only rational choice for everyone. In some areas of the country, like parts of New York and Florida, the situation exists on day one of a 65-year-old's first eligibility for Medicare. The savings are usually under $2,000 at the outset, so that $26,000 estimate that you heard must have been illustrating a multi-year projection. I only illustrate a one-year projection because I think that's a more conservative, responsible approach to the risk assessment. Most sources of bad advice, like what you received at a seminar, are concerned about the loss of commission income the agent will suffer when a client purchases a less costly product. That would directly impact the agent's earnings because his commission is a percentage of the amount you spend on your insurance. This should not be a concern for the client who is trying to make a smart decision. Even if you ignore my experience and my experience and advice, all is not lost. The California birthday rule allows one opportunity each year to change to another company and another plan to take advantage of my recommendations. As for additional paperwork and bill payments, they will be so simple and infrequent as to be inconsequential compared to the satisfaction you or your family will enjoy from the knowledge that you have the most cost-effective health insurance available under Medicare. If you would like to see the quotes I would provide to somebody in your situation, please fill out and return the attached questionnaire. Let me know how else I might help you in this process. So that is an unusual amount of back and forth about somebody who wanted some additional details. Obviously, this is a cerebral type of person who is concerned about doing the right thing. And I think I was able to set him at ease about the amount of a burden that his family would suffer if he were in a coma and had high deductible Plan G. In effect, there would be no burden whatsoever. And speaking of burdens, I'm ready to unburden the audience from having to listen to my dulcet tones for today, Randy. What do you think?
Well, I wouldn't put it that way, but we have run out of money. I mean, the quarters are gone, so we really need to land the plane. And speaking of planes,
Yes.
I have some information that I think is really critically interesting today. Something happened on today's date, in 1931,
Okay. Today's date, this would be
and
July.
22nd, 1931. And just in case you didn't know what that was, Willie Post. Have you ever heard of him?
Wiley
Wiley,
Post.
why? Oh, excuse me, Wiley
Well,
Post.
well, it's he's an Oklahoman and I'm an
Yeah,
Oklahoman.
yeah, well, he was actually born in Texas, but we'll call him
Eh,
in
eh,
Oklahoma. But
Baja,
anyway,
Oklahoma.
so anyway, Wiley Post, what did he do today? He ended up being the first aviator to circle the world on a solo flight, and that flight ended on today's date, and it lasted for 8 days, 15 hours, 51 minutes, and it was the first flight. He had done it before, but this was the first flight using an automatic pilot of his own invention.
Oh, no kidding. No kidding. Now, do you know why else Wiley Post is famous?
Well, he crashed in Alaska in 1935, but other
Yeah.
than that, no, I don't.
Okay. Because there was another person on the airplane when he crashed in Alaska.
Yes, Will Rogers.
Exactly. They were buddies, and that was Will Rogers' death. Both of them died in that crash.
Yes, and ultimately, I'll do a little more investigation on that as to what they were trying to what they were doing up in Alaska. But I thought this was really cool because I am so interested in navigating. I'm so interested in aviation. I'm so interested in all that. And I saw this name. I've heard of Wiley Post, but I hadn't heard of Willie. But now I know who it is.
Yeah. Well, is there a picture of him there?
Yeah, there is. He was only 36 when he died.
Oh, I thought he was
So,
older than that. Wow. Well, he's got an eye patch. So,
well,
as part of your research, you got to figure out what happened to his eye and how does that affect flight aviation, especially in the earlier days when you might have needed
yeah.
depth perception.
Well, in this particular picture, he didn't have his patch on, but his left eye looked like it was like seriously out to lunch.
Yeah, there you go.
Uh,
That's got to be the one that's not real.
yeah. So anyway, that was my fun fact for today, but we need to go ahead and land our plane, close up shop, because we're out of fuel and quarters.
Well, I'll let you do your magic on that, but I want you to know that Wiley Post is a hero in Oklahoma, even though he
I'll
killed
bet he is.
Will Rogers.
I'll bet he is. Well, he's a hero of mine based on what he did. So here we go. 3 things, 4 things, 5 things I always need to do before we close up shop for us. Write down this email address. It's very important. dbj@mlmmailbag.com. You can reach out to Doug to ask a question, make a comment, or anything else you want to do. Doug is licensed nationwide to help you with your Medicare planning, especially around Medigap plans and Medicare supplement plans. MedicareForTheLazyMan.com. Check us out. That's our website. We would appreciate it in your wanderings through the wilds that are the internet. Leave some reviews for us. It's really good for us because we're trying to stay ahead of the travel logs, and so far we're doing a pretty good job of it. Last but certainly not least, thank you for joining us today. We love to have you with us, and we wouldn't want you anywhere else. But nobody ever checks. You have just spent about 32 and a half minutes with Doug Jones, the anti-insurance guy, originally from Oklahoma. Right now, he's living in Pugsleyville in Illinois at the altitude of 758 feet. I don't know.
Yeah, that's it. Good memory.
I finally got it. 758 feet.
That's right.
And,
I hope it doesn't change.
He's got so much oxygen available to him as in comparison to his Fortress of Solitude in Crave Creek. His cheeks are rosy, he's bright-eyed and bushy-tailed, and it's because of the oxygen.
Well, I spent the morning in the dentist chair, and the tooth cleaner asked me if I was a mouth breather. And
a mouth breather.
Yeah, well, I didn't realize that was some new category that dentists are going to be using to extract more revenue from, but it was, I thought it was like an insult. Are you, would you be a bad date for a lady who is civilized?
In my world, if somebody asks me if I'm a mouth breather, that's somewhere akin to asking me if I'm a Neanderthal.
That's exactly what I was thinking while I was answering the questions. In any event, we've got to get the heck out of here. So I'm going to say goodbye to Randy, and I want to say goodbye to all of the listening audience. We will look forward to seeing your smiling faces the next time we open up the doors for another podcast episode. Bye-bye.